I'm Dr. Nisar Garvindan. I'm a community and family medicine physician with an MD in community and family medicine from AIMS Rishikesh. So today our session is going to be on the tests of significance, and we'll just discuss a few points on practical ways where we can use this during Neet PG preparation. First point, why do we want to know a test of significance? First of all treatments you learn, okay, and all medication dosages that you prescribe, even something as simple as a paracetamol, 650 milligrams, 500 milligrams, it's all based on evidence. We know that. It's very clear, right? Now, all evidence is finally going to be based on statistical significance. If there is no statistical significance, there's not going to be a consideration for clinical significance, and that medication or the therapy is not going to come into common usage. That's how important tests of significance are. So if you can understand how to interpret these tests, then you can understand medical literature better, you can ensure that your treatment outcomes are also better. So that's how deep this test of significance goes. Now we'll understand what it is just briefly before getting into the practical aspects. So statistical calculation is applied to see a significant difference between a sample and the population. So if you can imagine, we have two scenarios here and between two or more samples. So imagine you have an entire subset of people who are going to be in a population, and then there's going to be a smaller sample here. So you can compare between these two here, between the sample and the population. Or it can also be that there is a comparison between two samples. So either we can have it within that entire population and then the sample is chosen, or you can have between two. So that's how we can compare. Now, any test of significance will have a value. And if it's more than the cutoff value, there's something called as a p-value. I'll explain in the next point as well. The p-value will be less than 0.05. I think most residents, most doctors would have heard this. What is a p-value? Is it significant if it's less than 0.05? So this is what it means, where it makes it statistically significant. P-value less than 0.05 means that there is less than a 5% chance. The difference has occurred by chance. Assume that the null hypothesis is true. So there's less than a 5% probability that the difference has occurred by chance. So you're 95% sure that the difference between two drugs or two therapies is significant when you consider that the new therapy is not different between the old therapy. You assume. That means that it's more often that there is a significance. So again, as the line goes, assuming that there is no difference between the sample and population or between two groups. So you assume that there's no difference, but even when you assume and then there is a 95% surety that there is a difference, that means that's a significant thing. That means that there is something important that we need to look into and further explore. So we'll get right into it. Approach to deciding the test of significance. All right. Now, this specific flow chart that you all see, we can consider this as the table that you can use for your reference in terms of how you approach your MCQs. This is the book called as Golden. I just wanted to how you first need to look at what is the type of data, qualitative or quantitative. Now, qualitative is something like a category, can be male or female, right? Or it can be the religion of the person, where the locality of the person is. It's a yes or no thing, or they're different categories. Okay. So when you see the data is qualitative, and you there say whether it's a paired or an unpaired sample. Paired samples are those where you do a before and after comparison. If you have a sample of 100 people and you see whether the drug is effective or not in reducing cancer. So you say before the drug and after the drug, cancer, yes or no. So that's a qualitative paired sample. Now, if there are only two, That it means you're only doing it before and after once time. So if that way, the test would be McNamara test. Next, if there are more than two samples, we do the Friedman test. Many of these names, I'm sure it's new to you, but it's to make sure that you keep reading them again and again, the specific table, because many name questions do come into the MCQs. All right. Next is the unpaired samples, wherein if you have two samples, so if you're comparing two groups, whether you say that they had cancer or don't have cancer, when you give them therapy one versus therapy two, right? So that time, what test you use is the chi-square test or the Z test. Okay, so you can either use either of these two. But if there are more than two samples, you cannot use the Z test. You have to use only the chi-square test. Okay, I'm just brushing through it initially so that you can solve the MCQs more easily. Next is the types of hypothesis under the quantitative data. Okay, so this is what it is. Quantitative data would be the types of hypothesis wherein the relationship or the association is present or not is to be checked. Now, if it's a normal distribution versus a skewed distribution. So normal distribution, I think, if it's present, it would look, if you have the bell-shaped curve, it's very straightforward, right? Wherein if it's absent, it's going to be either skewed to the left, skewed to the right. Now this one is left skewed, okay? So if there's normal distribution, if it's present, we use a Pearson's correlation. Okay. And if there is no specific normal distribution, we look at Spearman's rank correlation. So the way I remember it is the spear is pointed towards one side, right? So skew, you use skew as it's going to be pointed. So just think of it as you use Spearman's correlation for skewed data and Pearson's correlation for normally distributed data. Next is the if you're looking for association, you use this. If you're looking for just difference between the means, so if you have, I'll explain as and when specific point comes in. So you're comparing the mean values of variables. So if it's a normal distribution, yes. Then if it's a paired sample, now paired sample again. So if you have blood pressure measurements before and after, if you have one group, if you give amlodipine, you see how much millimeters of mercury it reduces it, right? The mean BP before the intervention, mean BP after intervention. So that time you're comparing before and after, you use the paired t-test for this because it's using mean values. Next is the unpaired sample. So the unpaired sample would be if you have two groups, okay? So two groups, if the sample size is less than 30, we use a student t-test or it's also called as unpaired t-test. So this is the most common one. Okay, that's called student t-test because students commonly use it. It's so commonly used. So next, if it's also we can use a Z test for difference between two means. Sample size is more than 30, we have to use the Z test here. Okay. Next, if it's more than two samples, we use the ANOVA. So ANOVA is analysis of variance. If there are more than two samples, you're comparing three groups, that time three or more, you have to use ANOVA. And if the result is significant, you use the post hoc test, or it's called as Tukey's or Bonferroni's test. You can get with the details later, but basically it says which of these three is the most significance among them. So that's what you use for Bonferroni. So next is if there is no normal distribution, it's skewed. The paired sample we use Wilcoxon's pair match test. If it's unpaired, so you're comparing groups, separate groups here. If it's only two groups, we use a Mann-Whitney U test. If it's more than two groups, we use a Kruskor-Wallis test. So that is the basic concept behind it. Make sure you are clear about what is your qualitative data, your quantitative data, whether they are paired or unpaired, and also whether if it's two samples or more than two samples. More often than not, if you're looking into each question and if you're analyzing this, you would be in a good position to answer the MCQ for this. Okay. Now let me just scroll through and solve two MCQs for you. First MCQ, a study aimed to evaluate the difference in mean height between boys going to government and private schools. So they're comparing the means between government and private schools. The data was not normally distributed. Now we see that these are two groups here, very clear, and this is a skewed distribution. Now, the test of significance used will be, so let's use this flowchart for this, okay? Now we're comparing the mean height. So the mean height would be, here would be the quantitative, correct? Type of hypothesis, you're comparing the mean, correct? Mean height, yeah, mean height. Next, we are saying that it's not normally distributed here, correct? Next, we say that you're comparing two different groups. So it's going to be an unpaired one, all right? Next, it's going to be two samples because there are only two groups, so use the Mann-Whitney U test. So we have all these options here. It's very clear. It is the Mann-Whitney U test that we'll be using in this question. I hope I clarified. Next is the second MCQ, wherein a researcher wished to check if there was a significant difference in the number of individuals with and without anemia among first year and second year medical students. Which test of significance can be used? So this is the number of individuals with and without. So there are only two groups that you can compare, and it is a number, which is a qualitative variable. And among this is the first and the second year groups. Okay. So if you use this, let's go up here. It's a qualitative data, correct? Now we have first year and second year students. So it's going to be unpaired samples. We know that there's going to be only two samples that we're going to be using. Correct? First year and second year students. So the final answer would be chi-square test or Z test that we can use. And when we go down here, this is a trick question wherein you have only chi-square, only Z test, chi-square or Z test or t-test. Now, there are situations where only chi-square test can be used or only Z test can be used and only t-test can be used. But this is a scenario where you can use either of these. So be very careful when you answer such questions on Z test. So this is going to be clear this doubt out for you guys. Let us again get back in position to understand it much better. Yeah. So first, what are the important things we see? I'll only underline the different categories that we get. Okay. So it can be either qualitative or quantitative. It's very clear. Next, we have to see whether they are paired or unpaired. Correct. Next, we have to see whether they are two samples or more than two samples. This is the usual categories. But here in this case specifically, we also have the association or no association. And more importantly here, whether it is normal distribution present, normal distribution absent. So if you are able to categorize, make sure that you are clear on what type of data it is, whether it's paired or unpaired, whether it's two samples or more than two samples in terms of qualitative, whereas it comes to quantitative, whether you're measuring association or the mean, whether it's normally distributed or not, and then whether it is paired or unpaired and how many groups they are, right? This overall sums up how we can approach the decision of making the test of significance to be used. This is all from my end. I hope you found this session useful. I'm Dr. Nisarg Arvindan. Thank you so much for listening.